How's everybody doing today? It's Dr. Melva. Come on in, come on in. While I get this light right. There's always a shadow there. How's everybody doing? Welcome, welcome, welcome. We are broadcasting live from Chesapeake, Virginia. Come on in, come on in, come on in. Welcome, welcome, welcome. It's Thursday, September 7th at 6:30 p.m. Eastern. Check my mic. Mic check, 1 2 1 2. Let me know if you can hear me. All right, welcome, welcome, welcome. Hi, welcome to the live broadcast. My lighting is not good today. Let's see. All right, how's everybody doing? Welcome, welcome, welcome. Come on in. I'm Dr. Melva, your Board Certified Radiation Oncologist, broadcasting live today from Chesapeake, Virginia. And today I want to give you some tips to weather the storm. All right. Let's see. You may hear some kids in the background. First week of school. They're all excited. Welcome to the live broadcast. Thanks so much for joining. If you're watching the replay, today is Thursday, September 7th, 2017. It is 6:30 p.m. Eastern. You know me. I'm Dr. Melva, your board certified radiation oncologist. I help people that have been diagnosed with cancer to navigate the cancer system, live their lives in spite of cancer through my videos, speaking, community cancer centers, and programs. You can find me right here on facebook.com/Dr. Melva, M-E-L-V-A. We'll get started in just a few minutes, so come on into the broadcast. Let me get the fan on. It's a little hot in here. Welcome, welcome, welcome. Welcome to the live broadcast. Oh, it's always hot. All right, how's everybody doing? Thank you so much for joining. Let me know you're here in the comments. Say, hey, Dr. Melva, I'm here. Type, hey, Dr. Melva, I'm here in the comments so I know that you're on today. Sharing is caring. If you get value out of today, please share with someone else who's in need. Our prayers and thoughts go out to the islands, Texas and Florida, everyone that's been affected by Hurricane Harvey, Hurricane Irma, and the hurricanes to come. Wanted to give you a few tips and review some resources that are available online for patients who have been diagnosed with cancer and dealing with a storm. Welcome, welcome, welcome. So we'll get started today. So we want to talk about weathering the storm with the diagnosis of cancer. So I went to the American Cancer Society site and read through some of their tips that they have in an article called Coping with Cancer After a Natural Disaster. And they have a section of frequently asked questions for people with cancer and their caregivers. So I think it's very important that we go through these. I kind of read over it. I agree with a lot of what they say, and I just like to add some of my own tips there. And then I also have another article that I like to go over with a medical oncologist from Texas who also gives very good advice. So we'll be using these resources. We are resourceful here at Dr. Melva and want to share these with you. So again, today we are talking about weathering the storm, coping with cancer through natural disaster. All right, so number one, if you have been affected in an area with storms, hurricanes, rains, please write this number down, or you can go to the American Cancer Society website. Welcome to the broadcast. Welcome to the broadcast. Please write this number down. The number for the American Cancer Society, they have a National Cancer Information Center. The number is 1-800-227-2345, and cancer information specialists are available to answer any questions that you have 24 hours a day, 7 days a week. Welcome to the live broadcast. Welcome to the broadcast. So if you've had to evacuate your home or leave a treatment center, or if your treatment plan for your cancer has changed because of the hurricane or the storms, please know that you can always call the National Cancer Information Center. Welcome to the broadcast. Welcome to the broadcast. You can call the National Cancer Information Center, and again, that number is 1-800-227-2345. They will have those lines open. Welcome to the broadcast, Dawn. Thanks for joining. They will have those lines open 24 hours a day, 7 days a week. So that's the first tip. Use your resources. American Cancer Society has a number, an 800 number listed where you can speak to cancer information specialists. Okay, so what do you need to do first? And again, these are tips from the American Cancer Society with some of my additional tips added. So if you are currently in a temporary shelter and there are health professionals on site, let them know right away that you've been getting treatment for cancer. So whether that's radiation therapy, chemotherapy treatment, immunotherapies, let them know, and the health professional at the shelter can help to get you into contact with your doctor or hospital as soon as possible. If there are no health professionals at the shelter or housing, temporary housing that you are going to, contact the key people at the center. So that would be the shelter director, a landlord, or the person that you're staying with to help you get in contact with the hospital. Alternatively, you can call that 1-800 number for the American Cancer Society, and they can help you to get in contact with treatment centers that are open during the storm or in other areas close to you where you may have had to go for shelter. Okay, and again, that number is 1-800-227-2345. Okay, if you have an emergency, and a lot of physicians have been sharing these tips, but if you have an emergency room and you're in a shelter and you're a patient with cancer, this is a time to seek emergency treatment. So if you have a fever that's greater than 101 degrees, temperature or higher, if you have shaking, chills, or sweats, if you have redness, any swelling, if there's pus or ooze or drainage coming out, if you have a new pain in your body, a bony pain, a pain in your stomach that's getting worse, you should seek treatment. If your neck becomes stiff, if your throat gets really sore, if you get short of breath where you just have a hard time breathing or a cough, or if you have any burning pain or you see blood coming out of your urine, that is the time to still go to the emergency room for those emergencies. And again, these are recommendations from the American Cancer Society. We're using our resources. If you're just joining the live broadcast or catching the replay, I'm Dr. Melva, your Board Certified Radiation Oncologist. Today we are reviewing tips for coping with cancer after a natural disaster. All right, so the first one, we said American Cancer Society has a 1-800 number that you can call, and they have a cancer information specialist on the line for you 24/7. And then knowing what to do in an emergency, and then how can you keep getting your cancer treatment. So if you are still in the area where your cancer doctor or treatment facility are located, and let's say you can't get to your appointments because of power outages, no transportation, damage to your home, or damage to your doctor's office or treatment center, be sure to call your doctor's office as soon as possible to see when you can restart treatment. So they will have information, messages on their answer machine about when treatment will be restarting. If you can't get in contact with your doctor, again, go to the American Cancer Society or try your treatment center or the hospital or the local emergency room, okay? If you had to leave your home during the storm and you're not in the area where you were getting your cancer treatments, then you will need to find a new cancer doctor, okay, or treatment center as soon as you can. So again, you can get help in finding a new cancer treatment center or new cancer doctor from the shelter staff, the American Red Cross, the Salvation Army, or your local health department. Okay, and if all else fails, you can go to the local hospital information desk, and they should have a list of cancer facilities that are accepting patients who have had to move from their area during the storm. Welcome to the broadcast. Thanks so much for joining. Okay, so what about your cancer medicines? So depending on what type of cancer you've been diagnosed with, you may be taking a medicine by mouth, an oral medication, or you may have been getting infusions in your arm for medications. So if you have medications you're taking for your cancer and you have those, be sure to continue to take your medicine as your physician, your cancer oncologist, has prescribed. Another important, tip that I would add is that if you're in an area right now, let's say you're on the islands or you're in Florida, and we know that you're bracing for impact of the storm, pack your medicines. Get your medicines refilled. Make sure that you have enough on hand right now before you run out, okay? So just a tip that you can do. All right, so what if you don't know what type of treatment you had? So one, if you have been affected by Hurricane Harvey or Hurricane Irma already and you don't have your medical records, Your insurance company keeps a record of the type of treatments you're getting. So for example, if you were getting radiation treatment, they would have an idea of when the date you started your treatment, what you were being treated for, how many treatments were approved with your insurance. So that's one way to help. Your local treatment center can also have your treatment medical records that you can send if you have to go to a different treatment facility. Welcome to the live broadcast. Thanks for joining. And let's see, looking at the tips the American Cancer Society has, that's basically what they recommend. Get your medical records if you have to go to another facility. Hey, Liv, thanks so much for joining the live broadcast. Or check with your insurance company. So the other thing that I would add, again, if you're in an area that will be affected by the storm and it hasn't yet, have a copy of your medical records. If you're getting radiation treatment, chemotherapy treatment, if you've been diagnosed with cancer, if you have allergies to medication, have that written down somewhere and keep that on your person, okay? That will help you to be safe. It will help physicians and other practitioners to take care of you if you have your own records, okay? All right, let's see if there are any other key tips. Thank you so much for joining the live broadcast. I'm Dr. Melva, and we are talking about tips for weathering the storm. Let's see. So I think we covered most of the frequently asked questions. So again, just to summarize, there are resources on the American Cancer Society's website. They have a 1-800 number that you can call, 1-800-227-2345. They will have cancer information specialists available 24 hours a day, 7 days a week. The biggest things are to have your medical records in store. Number 2, get in contact with whoever's in charge if you had to go to a shelter, your local hospital. And the most important thing is to keep yourself safe. So if you have a delay in treatment, usually it will be okay. And if you're concerned about your delays in treatment, get a call to your doctor as soon as possible. But for the most part, as soon as the cancer centers are able to open and give you treatment, they will get in contact with you. Thank you so much for joining the live broadcast. Thank you so much for sharing. Sharing is caring. We appreciate you coming on. So any questions about any of that? We'll look at some of the comments. It says, thinking about quitting medicine, shared your video. Thank you so much. All right, so I'm Dr. Melva, and today we talked about weathering the storm. Our hearts and prayers go out to all of those on the islands in Florida and Texas who have been or will be affected by the storms. Having cancer during a storm or after a natural disaster is very difficult, but it can be totally doable if we're prepared. So make sure you have your medical records. Know that the American Cancer Society has a number for you to call. Get in contact with your local hospital. And most important, if you need to evacuate the area to be safe, please do. Until next time, thanks so much for joining. I'm Dr. Melva, and I'm your Board Certified Radiation Oncologist. For other tips and tricks, please check out my website. You can find me right here on facebook.com/Dr. Melva. All right, until next week, I come to you live every Thursday at 6:30 p.m. Eastern. Bye. Thanks so much for joining.